Hello, it's Carmen Rawls, and I'm here to welcome you again to World Religions for Healthcare Professionals. Just wanted to share some information while I'm waiting on students to come for office hours. I'm at the college now, but it's lunchtime, so I don't see anybody coming in anytime soon. Anyway, I wanted to talk to you about the difference between religion and spirituality. Some people say I am more spiritual than religious, and sometimes we don't really know what that means, but I'm here to try to explain that and break it down for you and talk about why those things are both important for understanding in terms of a patient's health care. So religion is typically seen as an institutional sort of organization with shared beliefs and shared practices. So there are often like a framework of things that people believe and they practice. There's of course lots of really super long definitions of religion, but basically in terms of what we need to understand, religion is a set of beliefs that give the people a worldview that will then help them to make decisions in their lives, especially concerning things like how they think about life, how they think about the possibility of death, of birth, also just how they deal with mourning and these sort of things. Religions tend to have sort of not really a script, but a set of ideas that they can draw upon, oftentimes found in a sacred text, etc. Now with spirituality, it's different because it has different meanings for different people, because there's no set text. There's no set of beliefs and practices. People draw on things from non-theistic religions like Buddhism, Taoism, and even some pagan traditions, and oftentimes they will draw on sort of New Age traditions also. So that can really just affect how they see their world based on what they choose from different cultures and different practices. Now keep in mind that it's really important to know that beliefs and practices can change over time, both within religions and within spirituality. People grow in their faith, grow in their beliefs, accept new things, reject some old things, etc. And so it's key that when you have a patient that they are able to talk about their religion and spirituality so that you can know how to best help them. Because these are the things they'll draw on in terms of deciding how they will accept certain treatments, how they will mourn a possible loss of a significant other, etc. And the other thing is, when you know that information, you can source help for them. As I said, this is not a class about proselytizing, about changing someone's religion, but if you have a patient that practices a faith that you don't know so much about, you will at least learn what that faith is, in terms of what they believe, and you'll be able to then find someone who can help them with their practice. And that's important because we do know that health is affected by mental states, and mental states are often affected by what people believe. So here's a question for you all. How many religions practice fasting? How many faiths have a continuous cycle of fasting throughout a year, or certain days of the month or the week, etc.? And could you accommodate patients who are fasting? And how would you work with them if their treatment meant that they couldn't fast? And who would you go to ask if they needed to fast, but you felt that it was not necessarily good for their health at that particular time? Could you find someone to tell you, well, okay, maybe no fasting this month? I want to thank you. I invite you to answer those questions in the comments, and I will talk to you very soon. Thanks. Bye.